we looked at nearly 35,000 online reviews by patients of their doctors. The precise number was 34,748. And we did a fairly exhaustive analysis that reached a fairly understandable conclusion. The surprise was the degree to which we reached that conclusion. And that is that in 96% of the cases, patients who are most unhappy with their healthcare providers and complain about it online are not unhappy about the quality of their healthcare. They're unhappy with customer service related issues. In 53% of those cases, it was a communications problem. And surprisingly, only 35% of them were unhappy about delays or something having to do with wait times. So the big takeaway here is that communications is the big problem in healthcare delivery, and solving that will go a long ways towards helping the reputation of any medical practice in general. An excellent question is, why should healthcare providers care about online reviews? We all know they're not scientific, they're often very unfair, so why should we bother with them? And I think much of the answer lies in the fact that we're in a healthcare service profession. We're not just scientists, we're here to provide health care. So in this vein, when we looked at nearly 35,000 online reviews, what we discovered was some very easy remedies to improve reviews. The first one is better communications. About a third of the reviewers were unhappy with their care and gave their caregivers 1 or 2 stars out of a possible 5. And 53% of the time, those unhappy reviewers were concerned really about communications in the practice. That's a very easy problem to address. Improving communications to patients, especially when a physician is running late for an appointment, is critical. The second most common complaint was about long wait times. Well, there you have it again. If we can just tell patients when the doctor is delayed and that he is delayed with another patient whose case is more complex than expected, then most of the patients, I think, will be very understanding about that. So keeping patients informed is critical. And in the end, perhaps the most interesting finding is that 40% of 5-star reviewers, patients who gave their doctors 5 stars, were gushing over their physicians. They liked their bedside manner, they liked them as a person, they liked their quality of care. And if we can just simply make a few improvements in communications and scheduling, for example, scheduling the more difficult patients in the mornings with longer appointment times and the more routine ones in the afternoon, that kind of management can go a long ways towards reducing patient complaints along with more effective communications.